My name is Dr. Scott Sigmund. I like to describe myself as the original opioid-sparing orthopedic surgeon, healer of knees and shoulders, left and right, a host of the Ortho Show podcast, and chief medical officer of the Orthopedic Laser Centers. So my entire clinical professional career over the last decade has really been trying to influence and change the behavior of physicians, healthcare providers, as well as trying to empower patients to let them know they have choices. And so opioid sparing has been a passion, and that's where laser came into play. I was able to identify the laser as an alternative treatment option potentially for patients. And I did my research. I went to Italy, met with a laser manufacturer, and did a lot of real behind the scenes research evaluation. And the basic science of laser is actually quite strong. And so I decided to bring a laser into my private clinical practice, where I'm a partner at Orthopedic Surgical Associates in just north of Boston, as we said. I practice at a Lowell General Hospital as well as Drumhill Surgery Center, but those are not, I do not have ownership in those facilities, so I'm a private practitioner. So we tried the laser in the office and we had some very early success. And then I decided, why I do this in a very busy orthopedic office with lots of overhead and all kinds of people running around doing insurance and stuff. Why don't we open up a center that just does laser? And so that's what I did. And then the laser manufacturer and distributor came to me and said, wow, we really like this model. And we'd like to potentially franchise this across the country with you as our founder. I said, yes, I think that sounds like a great idea, that we can offer this, alternative to opioids. Remember, I always like to say, the opioid epidemic is the forgotten epidemic in the setting of a worldwide pandemic. And unfortunately, it's actually getting worse. And so our patients, have been home, they've been depressed, they haven't been working, and we've seen a real uptick in the opioid epidemic. So conceptually, we got together and we developed the orthopedic laser franchise. We have 9 facilities now open across the country, with another 16 that have been committed. So we're really excited about this as an opportunity for alternative treatment options for our patients with acute and chronic orthopedic conditions, such as the shoulder problems we've talked about. Now, again, with shoulder range of motion, we've all been taught, especially with surgery, more often than not, that we're going to keep them in the abduction pillow for 6 weeks. They're going to do pendulum range of motion only. They can move their elbow and fingers, but we're not going to go for early motion. However, there's more and more literature support coming out at this point that perhaps early range of motion will benefit the patient to create the force vectors that are needed for the fibroblasts to come in and lay down the collagen for the healing of the rotator cuff in an organized fashion. And so my surgeon friends and colleagues from around the country, they joke with me and they say, hey, Siggy, you're letting your patients do burpees in the recovery room. And I said, well, maybe not that exactly, but we do put them in a sling, but we get them out of the sling in 4 to 5 days. Once the block is worn off, we start early range of motion. So the idea of having the ability to have early functional range of motion at home with home exercises is actually very attractive for me in the setting of the surgical world. So we've really created a much better patient experience for our patients in the first 6 weeks after the surgical intervention, which has always been the worst. And so that, nowadays I get patients every day coming to me from afar, learning about the techniques that we use, asking us to care for them because they know other individuals that have had successful outcomes. And so I think that rotator cuff surgery, even total shoulder replacement surgery now at this point, can be done near opioid free. It's really quite remarkable.
Well, that's a couple of things there. One, let's talk about the total shoulder. The people that are recovering from the total shoulder or the reverse total shoulder have a lower anecdotal reporting of pain in that early period. And is that because, in your mind's eye, that we're dealing more with the bone than we are with the soft tissue? Or what do you think the reason that they are reporting out that their recovery is moving along more quickly?
Great question, Rob. And I think probably there's a few things. First and foremost, the people that have shoulder arthritis have been used to living with pretty severe pain for quite some time. Very few will undergo, if you have a rotator cuff tear, you fall off the ladder, you get surgery, 3 weeks later, and you get your rotator cuff fixed. You didn't have any pain prior to your rotator cuff tearing. Now, for the total shoulder patients, they've had chronic, pain and discomfort for quite some time. Now, remember, it's been about 3 years now, and many of the orthopedic surgeons that are shoulder specialists around the country now are incorporating the blocks that we're talking about, which is then, the patients may not understand that, but they're probably receiving these nerve blocks now that are prolonged as far as their action is concerned. And to be, if we think about the pandemic and how the world's going to change, well, one thing's for sure, more and more surgery is going to be done in outpatient surgery centers and away from the big white building with sick people, right? So, people don't want to go to a hospital where there's still COVID. We have 30 patients in our hospital still right now that are admitted with COVID. They're always looking for options. And if you listen to the pundits, as many as 80% of surgery will be done as an outpatient procedure by 2024. So that's the direction that we're heading. So I think that there's definitely things that we're doing, again, even within the total shoulder space, to make the patient experience, so much better for the patient. And, also, I'm a big believer in trying non-operative approach for as long as you can, right? Surgery is a last resort always, unless there, is an acute injury or a tear or a fracture or something that we know, surgery is the best first option. But the overwhelming majority of shoulder conditions can be treated non-operatively before recommending surgery. So I talked early on about, our laser. I'm the chief medical officer and founder of OrthoLaser Orthopedic Laser Centers. And that's where we got the idea of using the laser for COVID. But we're big believers in the combination of using laser with associated occupational therapy, physical therapy, whether it be in the setting of the office or at the home, for patients to do these exercises. It's quite symbiotic. So here you are doing this laser. What we try to do is every other day, if you can, go get a laser treatment. It takes 20 minutes. You can't hear it, feel it, or see it. It's completely painless. It's a pulsed laser. So patients really, enjoy the fact that they can go and have a quick and easy treatment. And then the next day we say, either do your home exercises, with the equipment that you have, or you do your physical therapy with your therapist if that's where you are. And the same thing for occupational therapy. So the combination of those two events has really helped us to try and, unload a lot of the patients that were canceled for surgery, or other patients that are looking to avoid surgery in the setting of a pandemic. So that's been quite helpful.
So when you talk about the laser and what's happening in there, on your website and places, you talk about, and forgive me if I'm saying this wrong, that you're activating intracellular communication, and in a much more pedestrian way, I say to people about using home exercise in a pain-free range, is that you're getting things moving again.
Absolutely. At the molecular level, the laser actually, it increases the temperature by about 3 degrees Celsius, well below any concern for skin necrosis. I mean, our laser technology has been around for over a decade without a single incidence of complication or skin burn. So we don't have to worry about that because it's a robotic pulsed laser. Many of the lasers that most physical therapists and occupational therapists are familiar with are handheld, and they have to move around because they generate heat, and otherwise you can cause issue. But ours does not, because it's pulsed. So it generates 3 degrees of increased Celsius, and then all the little molecules get moving a little bit. And then the other thing that it does is that it increases, we got to go back to your high school science here now, Rob, and we're going to go to the mitochondria, the powerhouse of the cell, which makes ATP, which is the energy of the cell. And it stimulates increased production of ATP. So the cells around the area that are being lasered wake up, and then they start producing these things called proteins, which are the communications that you're talking about. That's how they communicate between cells. And the reason it works so well for inflammation, even if you think about COVID is the cytokine storm. We know about that, right? The cytokine storm gets crazy. It creates this very powerful inflammation that the body can't recover from. And what that's mediated by is these proteins, and these cytokines are the proteins, and they're pro-inflammatory. But, God is good for whatever reason. When you focus wavelengths of light that are the right wavelengths to these cells, the cells now make proteins that are anti-inflammatory, and they block the formation of the bad proteins that create the cytokine storm. And that's what's happening. And that's what's happening for acute and chronic inflammation of the elbow, knee, shoulder, as well as in the lungs in the setting of COVID, which is why it works so well for COVID. And so it's a real cellular mediated thing. And it's exciting, the idea that you can take a laser, plug it into the wall, use the amount of energy that it takes for a hair dryer to be able to then, use it on these patients to create reduction in pain and inflammation.
Are we going to see this kind of technology in physical therapy clinics? Does it require an orthopedist to be the director of one of your clinics, or kind of build that framework for me a little bit?
Yeah, so the physical therapists are many of them are used to the idea of laser, and many of them will have a class 3B laser, which is a lower energy laser, but it can still generate the heat. Ours is the only class 4 pulsed energy laser, so that does not generate heat. It can be left alone with the patient as well, so it has a robot scanner. So you just set the XY grid and you can leave the room while the treatment's going on. But we have many physical therapists in our areas, around the area in which our centers are, that we have that symbiotic relationship where we're using the laser plus the therapy together, and that has really worked out well. As a general rule, in order to get the laser that we have, which is the MLS M8 laser, it is uniquely tied to orthopedic laser centers. But there's no reason that, depending on the location, that physical therapy could not be a part owner in a center such as OrthoLaser as well.
Interesting. And so we're really going back to treating that out of control inflammation and calming that down. Your website says you're having like an 80% success rate.
That's correct. We right now are really, with VAS scores, visual analog scores, we ask every patient pre and post treatment, and 80% of our patients are seeing significant pain relief. That's within the chronic space. But I would tell you, we use it in 2 other ways. We use the laser for acute injuries. So we'd have near 100% efficacy for that athlete, for example, that rolls their ankle or has an elbow strain, or has a minor fracture or a muscle strain. We put them under the laser. 100% of those patients will see improvement in a matter of 3 to 4 treatments. It's really quite remarkable. And then the other way that we use it as well, Rob, is because what is surgery? I mean, I describe surgery as iatrogenic acute inflammation, right? We take a knife to your skin and it hurts because we create inflammation, right? So we use the laser perioperatively to reduce the pain and swelling of the surgical intervention, so the patients also get better faster as well. So it's that I'm a all hands on deck approach to minimizing the exposure of opioids to our patients and really improving the patient experience, so that the patients, when they do go to church and work, they say, yeah, go get your rotator cuff fixed because, it really wasn't that bad and I'm doing really well. Yeah,
well, you're describing a continuum there where any place along the way, the patient could drop out and say, hey, I'm feeling better. I mean, it's fun to work on those athletes, and especially if they're famous, you get a little of that fame rubs off on you, but most of our patients are someplace between 50 and 85 years old, and things are just wearing out, And,
I did my training at the Curl and Job orthopedic clinic in Los Angeles, where we took care of all the major athletes from all over the world. And that was a tremendous year of my life. But, at the end of the day, it's really the weekend warriors. It's the regular people that are out there, as you described, that 50 to 80-year-old population. Those are the ones that are getting the wear and tear and where everything starts to hurt.
Well, that's really fascinating. Well, these are the topics I wanted to talk with you about today. And if anybody is interested in following up with you, what's the website you'd like them to go to if they're in this medical space?
So, there's a lot of ways you can find the fro. I've sort of been known for my hair now, guys. So it's like #FollowTheFro is my end line for everything that I do. But we're all over. I'm on LinkedIn for my professional account, where that's where I really talk about my opioid sparing strategies and all the things that we're doing to help patients. For the old people, you can find me on Facebook, Scott A. Sigmund, MD, there too, for family and friends. And then for the young people, we obviously like to be on Instagram too, because they're getting a lot of fun about what we're doing these days. So that's Scott A. Sigmund, MD. And then my personal website as well, scottassigmundmd.com. So lots of places you can find me. You can't turn on a computer and not find the fro too far down the ride.
Well, that'll beg a final. Tell us how you got to the fro. Was that after your first trip to Italy, or Was that
Yeah,
going on before that?
it's once the pandemic really hit, it was like you couldn't really get to get your hair cut. And I was like, we're just gonna let that thing go. And then it just became, it's funny, I'll go to a meeting. You remember when we used to go to meetings, right?
Yeah.
But people tap me on the shoulder and say, "Hey, love what you're doing. I follow the pro." So it's lots of fun. It's becoming now sort of a part of who I am. It's part of my brand, and we love to talk about it.
Well, I appreciate it. Thank you for the time you spent with us today. And